Hi, this is John Beener with Weise Counsel. Again, I'm with Dr. Gill Weise of Weise Pharmacy and Weise Natural Food Shop here in Jacksonville, Florida. And we're going to ask this walking encyclopedia, this guy who knows so much insight and wisdom, we're going to ask him about heart disease. Gill, give us insight on that. Heart disease, blood pressure. Do they relate together, high blood pressure and heart disease?
I say yes.
Okay.
I say yes, definitely.
Do you believe in open heart surgery, and what's the best choice for a patient that, doctors are pretty quick to do that surgery, aren't they?
Right.
Does it seem like?
Well, if it's an appropriate thing to do, but that's far down the road for me. If at my age, 85, and I'm doing what I'm doing, I'm not looking forward to anything wrong with my heart, though that might happen. But I try to take care of my body and protect it. So back to the immune system and back to those things that are good for the heart. If you look in Dr. Steve Sinatra's book, Metabolic Cardiology, he'll go through it with you and give you the formulas for heart attack, for high blood pressure, for age management, for articular fibrillation, for mitral valve prolapse. Every one of those formulas are the same. There's 5 things on there. Omega-3 fish oil, which has 2 components, EPA and DHA. They're both for the heart, they're both for the brain, but the DHA goes in the brain. You know, they often say, well, where does that come from? It comes from omega-3, the fish. They live in schools, so they're very smart. So that gives you DHA to keep your brain smart.
So they're in school together, huh?
So going to omega-3, and then the next thing on the list would be L-carnitine, which is an amino acid, which is powerful to regenerate the heart and keep it from stalling and skipping beats and doing things like that. There's about 22 amino acids in the body, and 3 or 4 of those go right into the heart chamber to encourage it to be stronger. You have CoQ10. CoQ10 brings on a big subject because in the American dream of taking more pills and more pills and more pills, you will find in there the side effects. But nobody wants to talk about the nutrient depletion of the drug. And CoQ10 is one of those things that's stripped out most often first. That's your oxygen. That's your oxygen loader. So an oxygen CO2, CoQ10, every day, everybody should be on 1 or 2 or 3 or whatever. Find the appropriate dosage, come see me. Then there's D-ribose, and people shy away from this. D-ribose is a sugar. I take it every day because that's my energy. That's the ATP, the adenosine triphosphate. And
I learned natural sugar, is that what you're saying?
Natural sugar, like honey. So it's a very fine grade of sugar. D-ribose, D, big capital D, RHIBOSE. Many companies make that. And you just put it in water and drink it down. Excellent for power, walking, or running, or tennis, or any of those things. But very good for the heart. And the 5th thing on there is magnesium. Magnesium, the lost mineral, which has been devoured, I guess, by, I don't want to say the wrong word, but it probably is the government that said you're not supposed to have too much magnesium, where magnesium is good for the stress in my body.
It calms you, doesn't it?
And it's good for constipation. So you have a constipation issue when the magnesium is too low, and you have a sleep issue when the magnesium is too low, and you have a stress issue when the magnesium is too low. So that's one of the major compounds, minerals that we should be looking at. You'll note that the magnesium on those 5 should be coupled with calcium, but we don't need the calcium. We have enough calcium. The formula for the electrolyte is sodium and potassium balanced, calcium and magnesium balanced, calcium and phosphorus balanced, and then zinc and copper. When you take the magnesium away, that whole apparatus falls apart because there's no magnesium to take care of the calcium. The industry, pharmaceutical industry, has found a way to do that. you take a calcium channel blocker for too much calcium. That's absolutely ridiculous.
Yeah, that's a shame.
We don't need to do that.